In the fast-paced world of modern healthcare, our attention is often consumed by the most visible and urgent illnesses: heart disease, cancer, diabetes, and other high-profile threats. However, many experts believe the most insidious dangers are not the ones that scream for attention, but rather the ones that quietly undermine our health over time. Dr. Robert Anderson, a leading authority in public health and nutritional science, is bringing attention to what he terms subclinical deficiencies, widespread yet frequently unnoticed shortfalls in essential micronutrients that, over time, can significantly erode our health and set the stage for chronic diseases. The hidden crisis of subclinical deficiencies. Anderson warns that the real danger of these deficiencies lies in their silent nature. Unlike acute nutrient deficiencies, such as scurvy caused by a severe lack of vitamin C with its dramatic and immediate symptoms, subclinical deficiencies operate subtly. People can feel completely normal while their bodies are slowly breaking down. This illusion of well-being is what makes the problem so dangerous. To paint a clear picture, Dr. Anderson uses the metaphor of a small, unnoticeable crack in an airplane wing. At first, it seems inconsequential, but over time, with enough stress and neglect, that tiny crack can expand and ultimately lead to a catastrophic failure. Similarly, small nutrient deficiencies begin to deteriorate cell function, compromise organ systems, and create systemic weaknesses in the body, often taking years or decades before the damage becomes evident. He attributes this growing problem largely to the modern American diet, which is heavily reliant on processed foods. These ultra-processed options may be high in calories, but often lack essential nutrients. We are eating plenty of food, but we are starving for nutrients. Dr. Anderson notes, the convenience of fast food, frozen dinners, and sugary snacks has replaced the nutritional richness once found in traditional, whole food diets. For micronutrient deficiencies, most Americans overlook or Anderson has identified for specific micronutrients that are alarmingly deficient in the majority of Americans. These deficiencies don't usually cause immediate health issues, but they quietly set the stage for long-term damage. Vitamin C. Although scurvy has nearly disappeared in the modern world, Dr. Anderson points out that nearly 40% of Americans have a low-grade vitamin C deficiency. This doesn't cause the bleeding gums and open sores associated with scurvy, but it still impairs essential functions. Vitamin C is vital for tissue repair, immune system support, and blood vessel integrity. A deficiency can lead to poor wound healing, frequent colds or infections, and microscopic damage to the blood vessels, which may contribute to cardiovascular disease over time. Choline. Choline is a lesser-known nutrient, but its importance cannot be overstated. According to Dr. Anderson, about 90% of people in the U.S. do not get enough choline. This nutrient is essential for maintaining the health of brain and nerve cells. It also plays a critical role in detoxifying homocysteine, a harmful amino acid that, when elevated, is linked to heart disease and stroke. Low choline levels can affect memory, concentration, and long-term brain health. Vitamin E. Vitamin E deficiency is another widespread issue, affecting approximately 87% of Americans. As a powerful antioxidant, vitamin E is crucial for protecting cells from oxidative stress. It prevents the oxidation of LDL cholesterol, often referred to as bad cholesterol. When LDL oxidizes, it contributes to plaque buildup in arteries, increasing the risk of heart attacks and strokes. Without enough vitamin E, your cardiovascular system becomes vulnerable to long-term damage. Vitamin K. Vitamin K may not receive as much attention as vitamins C or D, but Dr. Anderson emphasizes its essential role in both clotting and calcium metabolism. Up to 50% of Americans have insufficient vitamin K levels. This vitamin ensures that calcium is directed to bones and teeth rather than soft tissues like arteries. When calcium is deposited in arteries, it increases the risk of atherosclerosis and cardiovascular disease. Dr. Anderson calls this imbalance a ticking time bomb for heart health. Why conventional medicine misses the mark? According to Dr. Anderson, one of the major flaws in the modern healthcare system is its reactive nature. It is designed to respond to symptoms and treat diseases after they emerge, rather than preventing them in the first place. As a result, micronutrient deficiencies are rarely addressed until they contribute to a diagnosable condition. Even more troubling is the inadequacy of standard medical tests. Routine blood panels usually don't measure long-term or functional nutrient levels. Tests may not assess choline, vitamin E, or homocysteine accurately. Moreover, the definition of normal lab results is often too broad to detect subtle deficiencies. A patient may be told everything is fine when, in reality, they are operating on the edge of nutritional insufficiency. This creates a dangerous feedback loop. People think they are healthy because their tests come back normal and they don't feel sick, so they continue with the same lifestyle that is quietly undermining their long-term well-being. Shifting toward a preventative model, Anderson argues that preventing disease should be just as important as treating it, if not more so. He believes a major shift in mindset is needed to move from reactive healthcare to proactive wellness. Fortunately, this shift doesn't require expensive treatments or complex interventions. Here are 3 simple yet powerful strategies he recommends. Prioritize whole foods. Dr. Anderson urges people to return to a diet centered around whole, minimally processed foods. Real food provides a complex matrix of nutrients that supplements alone cannot replicate. He offers some specific dietary tips. Eat 3 egg yolks per day to meet your daily choline needs. Snack on a handful of almonds to boost vitamin E intake. Incorporate leafy greens like kale, spinach, and Swiss chard into your meals to ensure adequate vitamin K. These foods are not just nutrient-rich. They also contain synergistic compounds that work together to support overall health. Use supplements wisely while food should always be the first line of defense. Dr. Anderson acknowledges that it's not always possible to get everything you need from diet alone, especially given the depletion of nutrients in modern agricultural soil. In such cases, supplements can play an important role. However, he stresses that supplements should be used strategically, not as a crutch. They are tools to help close nutritional gaps, not a replacement for a healthy diet. Look for high-quality, bioavailable forms of vitamins and minerals. Consult a healthcare provider who understands nutrition to identify which supplements are appropriate for your unique needs. Cultivate a proactive mindset. Dr. Anderson believes the most critical change is psychological. We must take ownership of our own health rather than waiting for a doctor to diagnose a problem. Proactive health involves paying attention to your body, educating yourself about nutrition, and making small, consistent improvements over time. No one will care about your health more than you, he reminds us. This means taking simple steps today like eating more vegetables, reading nutrition labels, or taking a daily multivitamin can have a profound impact on your future. The bigger picture, a call to action. Anderson's message is clear. Subclinical deficiencies are a silent epidemic. They don't make headlines or trigger immediate health crises, but they slowly corrode the foundation of your health. By the time the damage becomes obvious, it may be difficult or impossible to reverse. However, this is not a message of despair. On the contrary, it is a call to action and empowerment. Every person has the ability to take control of their nutrition and, by extension, their health. Through informed food choices, smart supplementation, and a proactive attitude, we can dramatically reduce the risk of chronic disease and enhance our quality of life. This paradigm shift requires not only personal commitment, but also broader societal change. Dr. Anderson advocates for better nutrition education in schools, clearer food labeling, and more accessible preventive healthcare services. Until then, the responsibility falls on individuals to be their own health advocates. In a world where healthcare is often focused on managing disease, Dr. Anderson challenges us to rethink what it means to be truly healthy. It's not just about the absence of illness, it's about thriving, having energy, resilience, and long-term vitality. And that begins with recognizing and addressing the silent, hidden deficiencies that are more common and more harmful than we think.